everyone, welcome back to my channel. This is Kat. In my first video, I told you why I left academia and become a consultant. So after taking a quite long break after my defense and graduation, I started my job 6 weeks ago as a healthcare strategy consultant. I've been really enjoying what I'm doing now, and also many of my friends ask me, how do you like your job so far? Is it challenging? What do you do? So I want to use this video to address some of your questions and tell you about what do I do as a healthcare strategy consultant. So if you like my video so far, please like and subscribe so I can provide you more content about graduate school, tips for PhD, career development, especially if you're interested in healthcare consulting. Let's get started. So you might have heard of consulting before, and I also explained in one of my videos about management consulting. The reason why I didn't pursue general management consulting and chose boutique consulting is because I know that I'm really interested in healthcare. I want to dedicate my career to really understand the healthcare industry, better patients' life, and just use the knowledge that I learned as a PhD student to help people, right? That's why I chose healthcare specific consulting. So even within consulting, there are different ways to do it. In general, there are strategy consulting and implementation consulting. So if this is kind of hard to grasp, I can just give you a very simple example. Strategy consulting is basically you give your clients advices. So at the strategic level, what kind of big picture question do you have as a client? And we as strategy consultants basically trying to use data and analysis to help you answer those big picture questions. On the other side, there's implementation. So a very good example for those consultants are IT consultants. So typically the clients have a question, a very specific question, right? Let's say we want to digitize a lot of things on our website or using an app. So can you help us to develop this software? In that case, IT consultant really hands-on optimize the website, develop an app, help clients. So these are two very general big categories. In the case of me, I chose strategy because I think those are more big picture questions I'm really interested and very quick turnover. So typically within 2 months, you should finish one strategy questions or project. On the other hand, implementation takes months, years to really achieve the goal of the client. So I work as a strategy consultant, okay? So that's first, we're clear. So second, our company really focus on the growth parts of the business. So for example, our client is losing their profits, right? So what are the reasons that our clients are losing their profits? Is it because, they hire too many people? The simple answer to that is just lay off 1,000 employees, And a lot of management consultants just offer such advices. There are memes around on the internet, hire a bunch of high-paid consultants, and then the advice that you get from them is, just lay off all these staffs, which we don't do in our company. We really focus on the growth part of the business. We really want to help clients to grow their business, to grow into a new market, grow into a new disease indication. So that's the second thing that I want to clarify what I do. And third thing is, if we dive deeper into the industry, within healthcare, it's also very complex. It's not just drugs, okay? So what we do is 4 different sectors of the healthcare industry. They're biopharma, they're medtech, they're diagnostic, and digital health or health IT. Well, with my background, definitely I'm more interested in biopharma because I came with a neuroscience genetic background studying rare neurological disorders, and I really want to use the knowledge that I have in the past few years as a PhD student to help patients, to help our clients develop new drugs, to help those patients. However, at the same time, the reason why I'm so interested in consulting is also because there are so many other questions that we can address. This is a great opportunity for me to learn other sectors of the healthcare industry. That's why so far I've worked on 2 cases, and one is diagnostic and one is medtech, which is not biopharma. But I had so much fun working on this project while I'm still working on them. So I cannot disclose any of the details of the project, but I can definitely walk through with you what do I do to answer these questions. As I mentioned in my other videos, answering consulting questions is very much like having a thesis project within 6 weeks or 8 weeks. So you are given a question from the client, right? Let's say, what disease indication are we going into? So you have to lay out the whole proposal how to answer this question, right? Just like how when you are writing your qualifying exam, trying to defend yourself. So first thing you have to do is to give a hypothesis, right? So let's say the question is, what disease indication should we go for since we are a gene therapy company? Okay, we have really great vector technology. So let's say your hypothesis, okay, because we have this great technology, we should go for a rare blood disorder. So let's say that is your hypothesis, blood disorder. Why? Why we should go for that blood disorder, okay? Then you have your sub-hypothesis. Let's say, okay, so this blood disorder, there's no current effective treatment for that, right? You know, they affect a lot of people, very high unmet needs, but no effective treatments, right? And then physicians would recommend the gene therapy if this is developed, patients are really eager to try a new treatment, and then the market is really big, blah, blah, blah. Okay, so that's within your first branch of the high unmet needs. And then you could have another pillar or another second hypothesis saying, actually the regulatory landscape is really good at this moment because FDA just launched this whatever new program to support such breakthrough therapies, and you know, insurance would really reimburse it, blah blah blah, okay? And then you can say, actually this blood disorder can be the first proof of principle of the technology, and this can really make our foot into the door of the gene therapy market, and we can actually have multiple programs follow on after this new blood disorder. So this is something that we really call as a framework or issue analysis, whatever terms that you use in different firms. But basically the idea is you lay out your hypothesis, sub-hypothesis, what kind of specific question you have to answer. And then after you lay out this whole tree or the framework, and then we come with analysis and research. I always make analogy, this is like writing a grant. You basically have a big hypothesis, right? Why are you writing this grant? What kind of question you are trying to solve? And what is your hypothesis, right? And then you have your aim page, right? You have aims, sub-aims. It's literally the same, okay? So here, our aims are trying to answer the questions that we just lay out. And then, you know, here comes your experiment design, which your methods part of your proposal or your grant, I guess, right? So in the case of consulting, how do you answer those questions? How many patients out there with this blood disorder? So we do our market research. That's what we do in consulting. You wanna use the data from CDC, you wanna use the data from the analyst report, you wanna use the data public available, read papers from PubMed, collect your epidemiology, and collect what kind of current treatments are out there for this specific blood disorder, right? And really trying to answer how high the unmet need is, okay? You can answer all these questions with your market research by reading papers, just like, you know, doing your research, right? However, certain questions may not be that straightforward, just Googling or go to the databases. There are some questions you have to do experiments with, right? Just like your proposal or your grants. So that's where you design your experiments and then try to use those experiments to answer the questions on your aims page, right? Same thing on consulting. We do our own experiments. What we do is we want to know, let's say, if there's this gene therapy coming out, what are the feedbacks from physicians, right? How do payers think about it? Will they cover for such therapy? And what kind of price points that they will cover, right? So all these questions, it's definitely not on the internet. So we have to do our own experiments. We write out these questions and then we talk to them. We talk to physicians, we talk to researchers, experts on the gene therapy field, experts studying this specific blood disorder. We would also talk to the payers, private insurance companies. What do they think about this new gene therapy, right? So what kind of evidence they need to be convinced to cover for it. All these are our experiments, right? And we finish them also within pretty much 2 weeks. Depends on the length of the project. And then that's our research part. And that is your methods part on your proposal and your actual experiments, right? To answer those questions. Well, so now let's say we gathered our data, we did our market research, we know how many competitors are in the market, all this public information as well as the research that we did, talking to the physicians and payers. We have all this data. Now is the analysis part. And just like how you collect your data and then use Excel, use different software to analyze your data, same thing. We do our surveys, we do our interviews, and we collect our data and then make it presentable, right? So ultimately, your task as a PhD or as a researcher, you write a paper, okay? You write a paper telling people what your findings are, how you contribute to the advance of our knowledge. Same thing. We collect our data, analyze our data, make our models, and put them into a PowerPoint and present it. Okay? We sometimes write papers too. So it's very, very similar process. So let me just recap what we do as healthcare strategy consultants. We are given a question, we lay out the hypothesis, we lay out the framework, how we can address these questions to support our hypothesis. We search for data, we do our own experiments, conduct interviews and surveys, we collect our data, we analyze our data, and we make it presentable. Just like how you write a grant during your PhD, just like how you write your F32 as a postdoc, just like how you're gonna write an R1 if you're a PI. It's exactly the same. Everything you just shrink into a 6 or 8 weeks of project. Ultimately, you don't have to do a hands-on experiment, you do phone calls, okay? Very simple, very straightforward, but a lot of fun. You know so much more within that 6 or 8 weeks period of time. It's only been 6 weeks, but I know so much more already about that specific disease and that medtech industry that I was on my first project. Also, the second one, I know so much more about that diagnostic tool in that specific disease indication. I had so much fun, and I just feel like I can learn so much more if, be in that world for another year. I just can't wait to learn as much as I can, learning about new knowledge, but also, soft skills, presentation, talking to different interviewees, writing skills, everything. I'm having so much fun. So I really want to give you my perspective about my work, and I want to share with you how happy I am working as a healthcare strategy consultant. So please let me know if you have any questions. I really hope you enjoy this video. And if you do, please don't forget to like and subscribe. I will see you in the next video. Thank you so much for watching.